and welcome to my presentation for my AI certification. Thank you so much for being here. I started out not knowing what to present, so I asked Claude, who initiated the suggestion I present one of my own AI tools, as other AI tools publicly known and may not add a lot to the conversation. I chose Visit Prep AI because most people at one point or the other will need to visit a doctor or at least should have an annual physical. Put a 1 in the chat if you've seen a doctor in the past year, and put a 2 in the chat if you need to make a doctor's appointment for your annual. The is a preclinical visit AI intelligence tool designed for patients going to see their primary care physicians. It's still in its infancy stage and is expected to evolve. But as a backup, I also decided that I will share or show the working of Office Agent, basically. So let me see if I'm able to flip my screen to screen 1. There we go. All right, so we're going to demonstrate real quick how Office Agent can create beautiful slides for us in the time we are making this presentation. And I'm going to ask it to please create a stunning PowerPoint presentation based on this outline. This is the outline that was given to me by Claude and the same outline that was used for the presentation. You're going to paste it in there. It's going to ask me a few questions and I will get it answered and we can move forward. All right, very good. It just wants to clarify the task. So it's going to ask me questions to help clarify the task. We will answer the question and go back to what we were doing while it works. So I wanted to focus on market opportunity, AI technology, and I will choose a template. I like this one, and we will apply it and submit and let Office Agent do what it does. All right, now we go back to our presentation. Excellent. So the problem is that a lot of people arrive unprepared and as a result forget the most important thing they wanted to talk to the doctor about. And they might remember either towards the end of the visit, which creates a very awkward situation for them and their physician, who has to keep somebody else waiting in order to attend to their question or ask them to reschedule, leading to frustration, especially as it takes weeks to months to get in with the doctor. 15 minutes is not nearly enough time, especially if you're not prepared for your visit, and every minute counts. So I believe that preparation is very important. Put a 1 in the chat if you're someone who went to the doctor and came back home or remembered in the car that there was something you needed to have talked to your doctor about and forgot to. So this is without AI versus with Visit Prep AI. I'm going to say that there's a popular saying that luck is what happens when opportunity meets preparation. And if you're not preparing for your doctor's appointment, you might be leaving a good portion of your health to chance. Preparation helps you advocate for yourself as the AI generates personalized questions. It helps you and your doctor get on the same page and ensures that you get the best care possible as soon as possible. So the AI generates personalized questions and you get good care. What's not to like? So here we go. I am going to click on Visit Prep AI. It is a patient-facing preclinical visit intelligence tool that helps generate a personalized visit preparation guide that includes questions to ask, symptoms to mention, what you're due for, what to bring for your doctor's appointment. And these are questions that a lot of people ask ChatGPT or Google. So we are going to flip the screen to where it is showing that. And say we are talking about, let's say, Matt. He is a 55-year-old executive. His younger brother just had a heart attack, and Matt is worried about his health. So he came across Visit Prep AI and decided to check it out. So he decides to get a free preview. It's free till the end of the month. And he looks at our disclaimer. It does not provide medical advice, diagnose conditions, recommend treatment, or replace medical care. So you have to agree to continue, and we will say his email is mattsmith@gmail.com, and he agrees that we can send his visit back to his email if he needs it. He enters his age, which is 55. Matt has been smoking for 25 years, and so has his brother. He is a man. He doesn't have any problems. This is a wellness visit. So he goes next, but he's been told he's recently that he's might be diabetic and his blood pressure is high because he's on a high stress job. And he's a big boy, so his BMI is above 30. So he's a little chunky, which is okay. And he smokes, and we're going to put that in there. And he smoked for 25 years, like we said, and we're going to go to next. If he was a woman, additional questions would come up, but he's not, so we'll go on to next. The history he's worried about is his male relative with a heart attack. So he can add anything else he wants if he wants, but we are going to go ahead and generate a visit back. So here is Matt's visit back. It is educational only with the recommendation you seek care if you're having symptoms. A lung cancer screening is recommended for him, and this is based on USPTF guidelines, and these are some questions he can ask his doctor. There's also additional general visit prep. These are like general free tools, but the entire pack is free for the rest of the month, but with answering some questions to help us improve. So he's going to say yes and unlock his pack. He's willing to answer a few questions to help improve your experience. This is a code that will help him open his pack from any device at all with his email and his access code, so he can copy it or just, save it somewhere. And he can view his pack right now, which is what he wants to do. All right, so his code is still right here available to him. And these are some questions, some additional issues. What is a realistic goal right now? Should we check metabolic labs, activity routine, things like colon cancer screening, which he is due for based on his age, and so on and so forth. Also things related to his diabetes, eye exam, kidney monitoring, his A1C. Some people are very health literate, so maybe the EMR also helps them with this, and they do not need Visit Prep AI, but there are places that the EMR is not so great and the health literacy is not so great. So Matt is willing to help us answer a few questions. He says preventive screenings were most helpful. He rates it likely that he will bring his visit back to a doctor's appointment, and he submits his feedback. And we are done with the demo part. Thank you very much. So we now go back to the rest of our presentation, basically that it's very simple to use. It's powered by AI. It's basically like having your own medical assistant who is right there with you and advocating for you. And the questions are personalized, and you arrive confident and ready to advocate for yourself. Our plus features include premium and plus features include refreshes on your phone whenever you visit the site, as long as you have access. There's access to a physician clone that explains your pack features or what's in your pack. Plus features also include things like notes and priorities. You can rank them. You have the ability to cross items off your list. So if you've discussed this with your doctor, you don't need to discuss it again. You cross it off your list. And you also have the ability to manage somebody else's healthcare, like your elderly parents or loved one. So you use your access code to get your pack on any other device. And I'm going to close with saying that when physicians lead healthcare AI, both the physicians and the patients win. And now let us go and see what's Office Agent has been doing for us. So it looks like Agent has been busy, and Agent has created some very beautiful slides and transforming the patient-physician communication through AI-powered preparation. The slides are beautiful and gorgeous and very, very well put together. It has graphs. It did a whole research. If you were, if you watched it, it did a whole research, and it came up with all these lovely slides for us. The health context analysis, intelligent question generation, organized preparation, why physician AI led AI matters, and the market opportunity. Isn't that wonderful? Well, thank you so much for listening to me, and this brings me to the end of my presentation. Hopefully, it recorded everything, and that turned out all right. Have a lovely evening or rest of your day. Thank you so much.